11 Alive News at 5 p.m. starts now.
First at 5, Atlanta Medical Center is now directing ambulances to avoid its emergency department to head to other nearby hospitals. AMC went on what's called total diversion at 7 this morning.
So the change comes as the hospital prepares to shut down the emergency room, which is going to happen on October 14th, and the entire hospital on November 1st. 11 Alive's Joe Henke is looking into the impact already being felt today.
After Atlanta Medical Center's ER behind me went on total diversion this morning, meaning they were directing ambulances to head to other nearby ERs. Those ERs were extremely busy or overcrowded for most of the day. The chief medical officer at Grady tells me it could be a direct result of the changes here at AMC.
It's not quite as rare as you might think. I mean, even occasionally we've had to go on total diversion when we've had too many patients. But what's different this time is they're not coming back off of diversion. So this is permanent, and we're already beginning to see the impact in our emergency department.
Dr. Robert Jansen is Grady's chief medical officer. He says Grady learned late last week AMC planned to go on permanent total diversion today ahead of soon closing its ER and the entire hospital. Jansen says the sudden notice, though, did not cause panic.
We've been preparing as best we can anyway, because we had already been seeing an increased volume as patients knew AMC wasn't going to be open.
But Jansen says he thinks the total diversion at AMC contributed to emergency rooms metro-wide being packed today. The Georgia Coordinating Council shows for most of the day Grady, Northside Atlanta, and Piedmont Atlanta have been on medical diversion, meaning at times they have been unable to accept incoming ambulances. Emory Midtown often listed as saturated, meaning it too was near capacity. Jansen says Grady is quickly putting short-term solutions in place while working on long-term plans. Grady has opened up additional areas to take new patient admissions, expanded walk-in urgent care clinic hours, added 29 beds adjacent to the ER, and a 24-bed mobile hospital will soon be in place.
So we have to be prepared short-term just to do the best we can with those areas that we can put patients and try to reduce the number of patients in the hospital appropriately, getting people out as quickly as we can and safely as we can.
And as they expand their emergency services, Grady is also adding staff to deal with the increase of patients. I'm told so far they've held 2 job fairs for Atlanta Medical Center staff, and around 700 people have attended those job fairs. Reporting in Atlanta, I'm Joe Henke, 11 Alive News.